Good morning and welcome to Ask Dr. Murphy, this week in public health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you doing this morning?
Doing quite well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines through today, August 21st, and we welcome any questions or comments down below or at any of our linked social media. As a reminder, you can see Dr. Murphy's sources and a breakdown of these stories through his Substack for free, which is linked in the description. Starting today with a big news story, the heightened recall of salmonella-contaminated eggs. Dr. Murphy, can you bring us the latest?
Well, salmonella is a bacteria that causes a very severe form of food poisoning, much more than Cyclospora, which is kind of on everybody's mind right now. But anyhow, there's been two big recalls with salmonella-contaminated products. The first one that you alluded to is the egg one, which came out of Midwest Poultry Services of Indiana. They found that there was salmonella, and they had to recall in their products, and they had to recall 1.6 million dozen. That's 19 million eggs. And that was from 17 states, with Texas being the most common. And the sale of those eggs, the distribution of eggs from this particular producer were mostly sold at Kroger and Brookshire grocery stores. So that's the story on the egg recall. Then the other salmonella story is the jalapeno-linked salmonella outbreaks. So jalapeños, the cases, this is from the Taylor Farms group that was associated with the Cyclospora outbreak, has grown to 431 cases, including 57 hospitalizations. And this has increased 86 cases and 21 hospitalizations, respectively, over the last week. The actual number of cases is probably much higher because it takes about 3 or 4 weeks to get sick from salmonella. So, you're always, by the time you end up in the hospital and get diagnosed, you're already a couple of weeks behind the ball. So salmonella is a typical food poisoning. It's causes fever, diarrhea, nausea and vomiting, abdominal pain. But young children and frail adults and older adults and anybody with a weakened immune system can get very, very sick, and it can be fatal. So it's a nasty disease, and it just means to say that we've got to stay on top of all this stuff.
Absolutely. And you mentioned it briefly, but can you bring us the latest update on these Cyclospora cases as well?
Still growing, 27,500 cases now. That's confirmed and suspected. This has resulted in 828 hospitalizations and 2 deaths across 47 states. So this is like now everywhere. Along with the major outbreak, this has been tied to the shredded iceberg lettuce. And the CDC and the FDA are now investigating at least 6 additional clusters of cases. So it's not just the original one looked like it was from Taylor Farms, from their subsidiary in Mexico or their affiliate, whatever that is. And Michigan has reported the most cases, but they're also very good at reporting. So it's a little bit of a mixed bag there. I mean, it's bad, but they may be a good reporter. So the other states could be doing worse, and they just don't report as good. But anyway, yeah, this is something that the fact that they've identified 6 additional clusters. This is really quite disturbing, and it's caused a huge decrease in vegetable consumption, especially lettuce. So be careful with the lettuce. Wash it, take off the outer parts of it and throw that away, and eat the interior, and don't, I would say, avoid the lettuce that's already pre-cut.
Yes, very good advice there. And another story that we have been following all year long is that of the measles. Now, we have lots of different aspects of the measles story today, but can you start out with the updated case numbers and where we're trending?
So the measles situation is not getting better. We are now higher than we've been in 35 years. There's over 2,777 cases right now. And this is more than was all reported in last year. And, why is this happening? Well, if you just look at the number of kindergartners who have received vaccine exemptions, this has increased from 3.6% exempted to 4.3%. So that translates, that doesn't sound like a huge number. But if you actually look at the number of kindergartners, it's 280,000 kindergartners did not receive their shots. So 280,000 is a lot of people, a lot of children. And measles is so contagious. If you don't have over 93% coverage, and preferably 95%, it will spread. That's how bad it is. And these are the averages across the United States. And it turns out there's many states that are above 5% exemptions. And so those states are really, really in trouble. And that's where you're going to, or any region where it's 5% or more. So that's number one. So it's not going away. We're going to have thousands of cases, hospitalizations, and deaths. They have calculated that to take care of a measles case is the average is $60,000 per case, because some get hospitalized, they end up in ICUs, emergency departments, all that stuff costs money. And that's $134 million right there. That's an estimate. Now, the second thing with the measles, what's going on right now is, we talked about this before, but the directive from the executive office is to split the measles vaccine, which is now MMR, measles, mumps, and rubella. The three diseases have been in one vaccine since 1971. To split them, and you have to take them individually each at a different time. So right now you take the measles vaccine, the MMR vaccine twice. All right. So if you split them, you're going to take measles twice, mumps twice, and rubella twice. So that's actually going to be 6 visits to complete the immunization schedule. So it's going to be very inconvenient. And every time you make a person come back for something, you lose some of those people. They don't show up for whatever reason. They forget, it costs too much, they can't take off work or whatever. The inconvenience factor from a public health perspective is you lose a lot of those people along the way. So that's one thing. The other thing is the practical consideration of actually splitting the doses is enormous. Basically, the manufacturers, and MMR vaccine is a very low, because it's out there, for so long, it's a very low margin product. So they're going to have to go back and split the measles, mumps, and rubella make different vaccines. They're going to have to test those vaccines before they can get approval. And the testing will likely require new large clinical trials for not both, all 3 of the different products. And this is going to take probably years to do. And the companies are really reluctant to do this because it's not needed. Let's start there. It's not needed. And most likely, the next administration that comes in is going to reverse this decision. So if they invest all that now into splitting the vaccines into 3 parts, this whole may be futile because most likely the next administration person or the next secretary of DHHS is going to reverse that decision because no one agrees with it. No expert agrees with it. American Academy of Pediatrics, the Infectious Disease Society of America, every professional organization, the WHO, all these groups, nobody is going to do this. Nobody agrees with this. Many of the state health departments are, scratching their heads like, why are we bothering with this? So for right now, you can't even do it. Because the products don't exist. So I think the next year, everyone will be okay. But we'll see what happens after that. If they're going to make the companies split this and how that's going to happen and the logistics and, if that's going to get reversed or if it's not going to get reversed. But the important thing to remember is that it doesn't have to, you don't even have to do this. This is just one of those unscientific political decisions.
Absolutely. And at the end of the day, it will come down to the decision making of the new CDC director, Dr. Erica Schwartz. So we will see her reaction on that. We are keeping an eye out for it. But we do have another story.
We have a lot of faith in her, and we hope that she does, looks at it carefully and makes a sound decision. Keeping in mind that the last CDC director was fired after 30 days because they didn't follow some directive. So poor Erica, good luck.
Yes, very difficult situation for her, but like you said, we have faith that she will follow her scientific directive as well. Now, we've talked a lot about mosquitoes and ticks this season. We have a new tick story this week talking about Lyme disease and the spread as our final story today. Can you bring us up to speed?
So Lyme disease is a tick spread disease, these black-legged ticks. And they've been in the northern upper Midwest and the northeast coast of the United States where they have a lot of Lyme disease. Lyme disease takes, the tick actually has to be on you for like a day and a half before it actually infects the person. So you have time to get the tick off and stuff like that. But ticks, there's a lot of ticks out there. So the ticks, turns out they're spreading. They're moving around and they don't know any political boundaries or state boundaries, national boundaries, international boundaries. And so it turns out they're down in North Carolina now. So North Carolina has joined the Lyme disease club. And they found nearly 40% of black-legged ticks in residential properties in Biltmore Forest, North Carolina, tested positive for Borrelia burgdorferi, which is the bacteria that causes Lyme disease. And tick surveys in nearby South Carolina showing lower prevalence suggest that the Biltmore Forest represents the leading edge of the southern extension down the Appalachian Way. So they're finding it in local residents and whatever. And so just Lyme disease is spreading is, I think, the people just have to be concerned if they're going particularly to those areas for vacation or visiting people. For whatever reason, you're out there and you can get bit by a tick.
Absolutely. And very good to know. As we always say, do your best tick prevention and your best mosquito prevention. Always best to protect yourself against any of these diseases. But on that note, I'd like to thank you, Dr. Murphy, for your expertise, bringing us up to date on all that's happening this week in public health.
Well, thank you, Katie, and have a great weekend.
Thank you. And thank you all for joining us. We hope to see you back next week for Ask Dr. Murphy This Week in Public Health. And of course, any questions or comments are welcome down below. And Dr. Murphy's sources and a written summary of all of these stories is available for free on Substack. Have a lovely weekend.